20% of Americans still smoke, even though it's the biggest risk factor for developing lung cancer. And for those who get lung cancer, only 15% survive.
If you take the number of mortality related strictly to lung cancer, you can add up the deaths caused by the next three most common cancers, breast, prostate, and colon cancer, and lung cancer deaths still overwhelm those.
Dr. Murthy says the number of cigarettes you smoke each day and how long you've been smoking determine your risk for lung cancer. There is no safe number.
Anything more than 0 cigarettes increases your risk for lung cancer.
That goes for cigars and pipes, too.
Those who don't inhale, which is sometimes hard to believe, still pose a risk to themselves for getting oral cancers.
So mouth cancer.
That's correct. Of the upper swallowing tract as well as lung cancers.
Other lung cancer risk factors include exposure to secondhand smoke, exposure to radon gas, asbestos, and other chemicals, a family history of lung cancer, excess alcohol use, and some smoking-related lung diseases such as emphysema.
Tell me about the electronic cigarettes.
The major problem with electronic cigarettes is that they play into the same addiction that makes it difficult for patients to separate from tobacco. Namely, they are nicotine dosing systems. They give patients continuous doses of nicotine, which serve to curb the urge of those patients to light up a standard cigarette. It turns out that there are other things that electronic cigarettes utilize, namely antifreeze agents, and some of these other things, as they are being inhaled by patients, can cause other health problems.
Yes, quitting smoking is hard, but there is help available.
There are support groups, there are medications, there is family support, and there are specific tobacco cessation programs at most major medical centers.
So who should be screened for lung cancer?
That generally falls into the category of older patients, say anyone over age 55, who have lengthy tobacco use histories, generally greater than 20 to 30 pack years of tobacco use.
During the last 5 years, there have been tremendous advances in the diagnosis and treatment of lung cancer, and those cancers caught in the very early stages are the most curable. For Fox 8, I'm Dr. Marc.
Dr. Marc is sponsored by the Cleveland Clinic.